future wars are going to be fought over a lack of access to food and water. And we know that we have a lot to offer in terms of creating sustainable food systems, effective water management systems. We know that through Feed the Future, we can help 18 million people move out of a condition of poverty and hunger, including 7.1 million children who will otherwise be stunted. And so when I went into communities and saw that 72% of the kids in Western Guatemala are stunted, 43% of the kids in Ethiopia are stunted, that made me wonder, what does that actually mean? And we've now seen MRI brain scans that show you what that means. That means kids who are malnourished don't have the same amount of brain matter as kids who are not. Their ventricles are larger. They have fluid where they should have neurons. And as a result, they will never achieve a level of growth and vibrancy that they ought to as a child. In health, we know that we have perhaps the greatest opportunity to save child lives over the next 5 to 7 years than we have ever had in human history. The combination of new vaccines, effective malaria control programs, the prevention of the transmission of HIV/AIDS from mother to children, and some basic work on sanitation and access to clean water can reduce by almost 50% the 8 million children that die every year under the age of 5 needlessly. We're in a fight for our lives, and we're in a fight for this body of work. America has been the leader. We are 53% of the global relief in the Horn of Africa. That's not going to happen if some of the budgets that have been proposed with 30, 40, 50% cuts in food aid and development assistance and global health transpire and become real. So we need your voice. We need your learning so we can get better every moment and prove to our supporters and our detractors that we're a more efficient, results-oriented enterprise. And we need to do our work in a way that more deeply engages all types of Americans.